So yeah, I think last time there was a problem in the connectivity and I could not answer your questions, so my assistants were bringing on the questions to me. In that there were some questions which I could not answer, so if you can write the questions again, we'll start the question answer session at the earliest. Before that, if there are no questions, let me tell you something about a case. Now see, whenever we have cases where we have a typical elements from, for example, if you have elements from bad news, elements from anxiety, elements from business cares, elements from cares and worries, then you have a specific reason and then the disease starts, so you can take that as a cause. Okay, so my assistants are there. Welcome, Dr. Harsh. Namaste. So when you say elements from, it is very important that you locate the history elements from that particular time. It is not like that you have a accident today, after 2 years you have fracture and then you take elements from fracture, elements from accident. Don't take that. Dr. Amit, good afternoon. I had a case where the patient, just recently, where we have results of a medical entrance test and the patient was expecting a good result, the child, and he did not get a good result. So he got a very bad news that he had not performed well and he had to repeat. And suddenly the child, had palpitation, had perspiration. He sat down, could not eat, could not think, and he just went blank. And after that, the child had a problem of passing stools and had constipation, and then other complaints with that. The child came to me after about 15 days. He had taken laxatives and it did not work well with the child. So now what to do? The child came to me because there was a problem. He could not score good marks. Because of that, everything started. So what do you expect? What do you think the remedy should be, and how will you proceed to the case? I basically give an open question to you all. You can suggest me first the symptom, then the rubric, and then try to get the remedy also. So welcome, Dr. Bharat. Doctor, sir, I am suffering from chronic anal fissure. Okay, so anal fissure basically, of course, it depends on case to case. I have a lot of cases which I have treated and cured anal fissure, but there are few cases that I have not been able to treat them and they had to get operated. So if you can tell me some symptoms pertaining to the anal fissure, pertaining to your disease, then we will be able to give the results to that case. Okay. Good afternoon, Dr. Abhishek. For anal fissure, basically remedy for anal fissure, you can take that. The basic remedy for anal fissure, the most important remedies: Ratania, nitric acid, chamomilla, thuja, graphitis. I have seen the most painful anal fissure. The patient was in so much pain. When he came to the clinic, he could not literally sit and stand also, and I had to see the patient early. And that patient was suffering from very chronic and habitual constipation for days. He could not pass stools, even after taking a lot of purgatives. In that case, we always think about Ratania, we think about chamomilla, but that case I gave the patient Lactafluoretum. Lactafluoretum cured that case within 1 week. Fantastic symptom, very painful anal fissure, chronic constipation, not relieved by purgatives. He came to me with a lot of pain, Lactafluoretum 200, and then after 15 days 1 gradually he got cured with Lactafluoretum. But within 3 to 4 days, I think in weeks time, he was 80% better. So it is very important to understand basically what are the presenting symptoms the patient has come to you, and what is the most troublesome symptom which the patient is troubled for. Okay, so let us go to the. Sir, these days lots of patients coming with fever and cold. Main symptom after fever is cough, throat, itching with coryza. What are basic remedies for your? Okay, coming from fever and cold, main symptoms of fever is cough. Okay, first of all, whenever the patient comes with fever, and cough, everybody, in fact I also have sometimes difficulty in treating the cases, but I'll tell you my experience. There are 5-6 remedies which I have found very useful in my practice. The first is of course arsenic album. Second, think about pulsatilla. Third, think about Hiparsulf. Fourth, think about lacasis. Fifth, think about phosphorus. And sixth, you can think about natramure. So these are the remedies you should think about when you are treating case cough with fever and infection. Okay. Hello, Dr. Bawal. Welcome again. So we were just talking of something about the case, and yes, so we have written everything about the remedies, Dr. Amit. So yeah, it was Amit only. Yes. So these are the cases. These are the remedies which normally should give you good results. Good afternoon, Navjot, Dr. Vishaka. Good afternoon. So we go forward now. See, of course, I had a case where it did not get better with arsenic also and pulsatile also. In that case, I prescribed the patient arnica. Now you say, sir, why arnica? So there were few symptoms of arnica that you should remember in cough cases that I have found it very, very useful in my practice. First of all, a arnica patient in the morning always suffers from raw and sore feeling in the morning. This is a very, very important symptom of arnica. First symptom. Second symptom, if you see arnica, there is acute tonsillitis. Don't confuse every time belladonna with arnica. Belladonna has some acute tonsillitis also, but there are something different symptoms with that. Arnica has acute tonsillitis with swelling of the soft palate and the uvula. The uvula is swollen in arnica. This is a very, very important symptom of arnica. And third symptom, dry tickling low down the trachea. There is low down, there is tickling and the cough starts. So these three symptoms of arnica has led me to prescribe with very, very good results of arnica. First, the rawness, in the morning, the acute tonsillitis and tickling in the lower part of trachea. These are three symptoms apart from lot other symptoms of arnica which I have seen. Yes, thank you so for your ever. Yeah, thank you, Dr. Babel. Yeah, arnica cough. Okay, so my assistant doctors are writing what I'm speaking, so it's very nice. Dr. Disha, good afternoon. So even I had a patient high grade fever but didn't settle with pulsatile arsenic, but settled. Yeah, very nice. And see, whatever remedy I have told you have worked. I have told you phosphorus, pulsatilla, arsenic, and now arnica I am telling you. So these are the very basic remedies. So most of the cases will respond to this type of remedies. If it does not, then you have to use your mater medica, use your presenting symptoms, and then prescribe the remedy. Okay. Sorry. So let us go forward. Okay. Urticaria only in the night, starts in the evening. It starts with severe contracting pain behind the sternum. Okay. Feels as if something is stuck in the middle of the chest. Pulsatilla, Naxomica did not help. Urticaria. Now again, urticaria is such a disease which becomes sometimes very, very difficult to cure. In fact, I had a similar case, Dr. Vishaka, where the urticaria was very bad. He had lot of symptoms, sternum symptoms, XYZ, nothing relieved. But then, I just prescribed only on the miasm. Urticaria after sunset. Urticaria after sunset, I took the remedy, and lot of itching till he goes to sleep. And in the morning, the patient feels better, comparatively better than what he was at night. I prescribed the patient just single dose of syphilinum, and the patient I cured that complaints. The patient was for me for 6 months. I had changed lot of remedies with temporary relief, but syphilinum 1M cured the case. Okay. Hello, Dr. Dhruva. Yeah. So behind the sternum, I have not got symptom like this. Yeah. Now, if you have got a classical case, if you have got classical case where you find that the patient has something which has been stuck in the sternum. Now, this is also very, very important symptom, Dr. Vishaka. And if you see this symptom, let me tell you, I had 3 cases. I had 3 cases with the same symptom. I prescribed the 2 patients pulsatilla and 1 patient China, and that resolved the case. This was a 3rd case of urticaria where the symptom was only after sunset, and syphilinum cured the case. I had few cases of urticaria where the patient is still taking treatment and he has not got satisfactory cure with the medicine, but the patient feels that if homeopathy can control, it's okay, otherwise he has to take steroids. So these are the symptoms. You must take urticaria, lump sensation in the sternum, 2 cases of pulsatilla, 1 of China, and 1 modality syphilitic syphilinum cured that case. Okay, I hope this is sufficient for you. Dr. Sahil, good afternoon. Oh, so everything is written by my assistant. Thank you so much. So let us go. So that case which I described, no, that case, the NEET got a bad news, suffered from constipation, loss of appetite, no result with any medicines, even with purgative. I prescribed the patient a single dose of calcarea carb 1 m in water, my dear friends. If you had, understood my question, what I'd asked you, elements from bad news, because that patient had not scored good marks in the NEET exam, and he got a phone from his father that this was the result. I prescribed the patient a single dose of calcarea carb 1 m in water, that is 4 pills in half cup of water, 1 spoon morning, evening, and the next day 1 dose. Totally cured with calcarea carb 1 m in water dose. That is the importance of taking elements from in homeopathy. But that elements from should relate to your case. No, it has to be an event which the patient can relate to that part of the cure, the symptoms, starting symptoms. Okay. Otherwise, elements from bad news we normally don't think for calcarea carb. We normally think about Staphysagrina, Silicea, Natrum mure, Arnica, Lycopodium. But sometimes calcarea carb is a fantastic remedy which I have got very very good results. In fact, if you see the repertory, if you see the Mater Medica, all the calcareas have elements from bad news. Calcarea carb, calcarea phos, calcarea sulf. Every calcarea has elements from bad news. So let us don't. You can ask your questions, because if my assistants are writing, all the remedies which what I'm telling you, then it becomes difficult for me to see. So in cough, most of the symptoms are common. Yeah. Very right. Whereas it is emulsion by sleep, please suggest how to go ahead respiratory symptoms. Calibaricum and Dulcaram, what is your opinion? Dulcamara, I think Dr. Amit, I have dealt in detail in the last YouTube, so you can go and check my last YouTube. The symptoms where it is emulsion by sleep. No, see, whenever you get complaints of cough, first of all, you have to understand and ask the patient, what is that symptom which is troubling the patient the most? This I always ask to my patient. What is that? For example, a patient could come and tell you, Dr. Saab, see, because of the cough, I have such a rawness in the throat. Dr. Saab, I have something on the tongue and I have to keep cough to take it out. Dr. Saab, I have so much dry cough, and I got a lot of urination because of that. So you have to see for what symptom the patient is troubled for. Now you have written cough is better by sleep. This is again a very very important symptom. We have remedies. Cough before sleep, cough on going to sleep, cough during sleep, cough after sleep, cough disturbing sleep, cough preventing sleep. Lot of symptoms we have. Now if you see the remedy manganum, it's a very very interesting remedy where the patient says that when I sleep, I feel much better. That is manganum. I have seen very very good results with that. Calibachrome, Dulcamara, basically routine remedies. Anybody, if you see Alan's keynote or if you see any Mater Medica, it is basically everything is given in the Mater Medica. Now what to take, that I am telling you. That basically that you have to ask the patient what is the most troubling symptom with cough, or what is that symptom which is troubling you because of the cough, and then the patient comes and tells you, and that is your remedy. For example, the patient says that before sleep I get so much cough, I feel whether I'll be able to get sleep or not. Coccus cacti, sulfur. Sometimes the patient says that there is so much cough that I cannot sleep, doctor. Lycopodium, pulsatilla, sepia. So in this way you have to differentiate between remedies. Now calibachrome, if you understand Kali and if you say calibachrome, the first symptom in calibachrome, anybody, if you can answer me this question, very very easy. Now these basically are remedies which are routinely prescribed. So I normally don't tell these remedies, because I think most of us know that calibachrome discharge is very thick and stingy. Okay, that is there. But if you ask me calibachrome, If you ask me Kali Bairaka, the first symptom that you should ask the patient is there is tickling in the larynx. That is the first entry point of Kali Bichrome. Tickling in the larynx and the cough starts. First symptom. It is written in Kali Bichrome, pain at the bifurcation of trachea on coughing. Whenever the patient starts coughing, there is pain in the bifurcation of trachea. Second, and of course, do remember the Kali Bichrome discharge. Yellow expectoration, very sticky and a very tenacious mass sometimes comes out, and it can be drawn like a string. That is Kali Bichrome. Okay, simple, whatever I can get my Mater Medica. Paresthesia after radiopathy in extremities. Okay, now whenever you are whenever there is paresthesia after radiotherapy, there are few remedies which are very commonly used in my practice, which I used, and I use in that case, I only see that the patient is suffering from paresthesia after radiotherapy, so I'll be only prescribing on that local symptom. Now, first of all, you must understand why there is paresthesia. Now, if you understand, because of radiotherapy, because of strong, because of strong medications, that part has a loss of blood supply or reduced blood supply. So we can also you can start with the remedy cadmium sulf first, second X-ray, third is radium brome. Just to tell you one thing, Dr. Barbal, very interesting question, and I'll tell you very interesting remedy also which I've used in my practice with very good results. Especially if the patient is of old age, 65 plus also we can take that. I have seen very good results with Ginkgo biloba. Ginkgo, Ginko biloba. Ginkgo biloba 30 potency in repetition, because I don't have Ginkgo biloba in LM potency. Okay. सर सालों भर चलने वाले सर्दी की ट्रीटमेंट पॉसिबल है? यस, डेफिनेटली आलम, बिल्कुल पॉसिबल है. Choking cough aggravation by talking. Now, see, whenever you are taking a case and the patient says that the cough is aggravation by talking, the remedy you can take two things. It is so much problem of talking, the patient has inability to speak. If a patient comes in obedient and tells, Doctor, he's speaking for 5 minutes, 10 minutes, and he's telling you that, sir, I cannot talk because of cough. But you are seeing that the patient he's been talking for 10 minutes without any cough. So, inability to speak with cough, you can think about Rumex, you can think about Moxol, you can think about Lacasis, you can think about Cuprum metallicum. But cough from talking, then you can think about Drosera, you can think about Sanicula, you can think about Spongia, you can think about Phosphorus, Phytoleka, Hiparcel. So inability to speak because of cough, the remedies are different. Cough because of talking, the patient coughs and then starts talking, then he coughs, then he talks, then the remedy would be different. So whenever you are taking history, try to take history which are very typical for that person. Okay. Kindly tell some medicines for extreme daytime sleepiness. See, whenever you are taking a case and there is no sleepiness in daytime, I can tell you a lot of remedies, but these are all symptoms, of a part of depression, a part of not feeling happy in life, and then you can have these type of symptoms. But still, if you have asked me, so I'll tell you some remedies which I have seen in my practice, So if the patient has a problem of sleepiness in the daytime, in the morning, you can write some remedies which I think it is Calcarea carb, Calcarea phos, sepia, sulfur, carbon sulf, graphitis. All remedies have sleepiness in the morning. Okay. Case of PCOD, you dear treatment have got good results with no pain during menses or heavy, but periods get still delayed by 2 months. Better with dose of Calcarea and Metronidazole. Dr. Disha, it's very nice. Just wait for some time. PCOD will resolve, and make sure that in these type of cases, a certain exercise is important. Food, especially taking a lot of salads, greens, antioxidant treatment, and wait. Don't repeat Calcarea cup or Metronidazole in between. It will resolve automatically. Give it some time. Sir, if Ubinev 30 is not available, can it take Q form, which form is best? I think 30 should be available, or today you can call from Amazon also, it is available, no? You will get it very easily. Stringy discharge, yeah, it's there in coccus cacti. Tickling in larynx and cough, these are okay, thank you, yeah. Paresthesia, Abhishek, coppery spots remain after acne. If the spots remain after acne, Dr. Saab, if you have treated and the spots remain, that means your remedy was wrong. It has led to discoloration. And if it is not there and acne after that, that means the patient has taken, a lot of treatment and it has been suppressed, and now those are spots. So in this case, first remedy you must think about is Bovista. Remedy where the patient has used lot of cosmetics and lot of local applications, and then the spots have been, the remedy is Bovista. Very, very important remedy, Bovista. You can think about other remedies also, like Cuprum metallicum is there. Whatever I can, lycopodium is there, carbamylase is there, and phosphorus is there. Does Nux Mosquet also help in extreme daytime sleep? Yes, definitely. Why not? It definitely helps. In fact, if you want to prescribe Nux Mosqueta, it means that Nux Mosqueta there's a concomitant symptom of sleepiness with all the complaints. So Nux Mosqueta covers that also. Okay. So let us go forward. There are some questions on the WhatsApp. Please don't ask on WhatsApp, so it becomes very difficult for me. Yeah, so somebody had asked me something last time, but I cannot get that. So let us go forward. Yeah, Nux Mosqueta sleepiness is a concomitant symptom. For acne, I've just had one symptom which I want to tell you. Whenever you are prescribing for acne, especially in girls or women or ladies, make sure you ask about the menses problem. Lot of females have a menses problem, and because of that there are acne. And don't always give pulsatile. If you have seen, if there are menses irregularities and acne, one or two remedies which I have found very, very useful. The first one is Sanguinaria can. Very, very important. Second remedy, you must write in your Matermedica, in your notes, acne because of menstrual irregularity, the remedy is Semesifuga, my dear friends. Semesifuga. And one, I will just want to tell you that whenever the acne is very painful, think about Arnica. Okay. How to select the potency depends upon the susceptibility of the case. Normally, I start with 30, then gradually go to 200, and if required, then go to 1M. If I've prescribed only on mental symptoms, then I can start from 200 or 1M. It depends on case to case. Okay, so let us go forward. There are some questions who have, I think, scrolled up because there are messages are writing whatever I'm speaking. So I think it's okay. I hope you're understanding, everyone. I hope you're getting what I want to tell you. If you understand, just write something, some thumbs up, or I know that you're understanding what I want to convey to you. Otherwise, I don't know whether you are understanding or not. I keep speaking fast because there are so many questions, yeah. Please make one video on potency selection. Yeah, I have to make a lot of videos, Dr. Nitin, because there have a lot of queries, making videos on my cured cases, making videos on some remedies. Owing to shortage of time, sometimes, I cannot make the videos but if you are if you are following my WhatsApp, my group number 9011303171, I have started putting cured videos. I have put few videos on, cured, like fibroids and ovarian cyst and brain tumor, diabetes I have cured. So you can just go through that video and get the confidence that homeopathy, has such a wide action and good results. Okay. So let us go forward. I think we'll not waste time. Yes, question. So yeah, so calcarea carb, I hope you understood something about calcarea carb, elements from bad news. Yes. And elements from bad news, calcarea carb, you must have not thought about. I don't know whether you think, but calcarea carb is very, very important remedies. We have just finished the entrance exam for the medical, and some have got good results, some have not got good results. So in that case, you must think about these remedies. Please put the remedies too in the video. Yeah, actually, the videos basically are managed by, I have now a lot of assistant doctors, about 4 to 5, they are working with me, and they become so excited that, sir, we have cured this and we have cured this. And sometimes what happens, they have taken the case, they have given the results, and it has been cured. So they're very happy. They keep putting it, So maybe they have not put the remedies with that. That's why. But it is just to gain the confidence for the doctors also and for the general public also. Yeah, this is curable, because a lot of patients come to our clinic and say, Doctor Sahab, in homeopathy can we cure thyroid? In homeopathy can we cure blood pressure? In homeopathy can we cure cyst? Lot of questions. So for them, basically, we have started this, that it is curable, and when the patient puts the videos, it feels very nice. And of late, because of YouTube and all, the patient hesitate to give the videos because they feel that we'll put on the YouTube and it does not look nice. Okay, person can't keep still and keeps rocking. Moves from, does it indicate? Yeah, why not? Why not? It increases the remedy. In fact, there was one case, I think 3 days back. One of my assistant had taken the case, and I had prescribed on this rubric only. Of course, in Kali Karv, it is there, and it is there. But there's a beautiful delusion, or you can say desires to be rocked. It is not only just the child wants to be rocked. Means usko maja aata hai. He feels happy when there is a lot of things going in his life. There's one rubric called as delusion rocked he is. The patient feels that sometimes I'm here, sometimes I'm here. Sometimes somebody tells me to do this, sometimes to do this. I am as if rocking here and there, here and there. So delusion rocked he is. Delusion desires to be rocked. Rocking amelioration. I feel happy doing 10 things at one time. Rocking to and fro, to and fro. Belladonna, Alzheimer's. So these are rubrics, you have to start understanding and converting that patient's language into rubric form. Of course, you must have somebody to tell you that you can take this rubric. It is very easy to make you understand the rubric, but when that rubric is applied on your patient and then the patient gets results, then it becomes authentic that you can take this rubric for this type of complaints. So whenever my assistant doctors are there and they take the case, I tell them, please note the name of the patient. I have taken this rubric, implied rubric title. They've never heard about this rubric. And then I tell them that when it gets better, just remind me so that we confirm that this rubric's word for this type of condition. I hope you understand what I meant to tell you, Dr. Kaliraj. I am trying to explain you that it is very easy to make you understand the rubric on prima facie. Every day on WhatsApp, there's one rubric and we are very happy. But applying that rubric on the patient and then getting results shows that that rubric is worth understanding and learning because it has cured the patient. So there's a difference between clinical application of a rubric and just mere understanding the rubric in English form or the literal meaning. There's a difference. This what I call as an implied rubric. That means rocking in the literal sense can be rocking and rocked also because he's going from here to there. That is also being rocked. Okay. I hope you understood, Dr. Kaliraj. I tried to explain you fast because we are in short. I have only half an hour, thank you so much. Thank you so much. One of my, I have made my group of my assistant doctors, So they always, yesterday they were telling me, sir, make us explain some rubric. And I gave them 2 rubrics to understand. Delusion, poor he is, and fear of poverty. They have both the rubrics which are different from each other. So one of my assistant wrote that, sir, we can't understand this rubric on WhatsApp, so take a Zoom. But nobody was interested, so I was very happy. So otherwise, if everybody is interested, my assistant, so I have to again take one Zoom lecture. So making them understand on Zoom also and my clinic also. So this is how you have to understand the rubrics. The implied rubrics is very, very important. Okay. Yeah, Dr. Kaliraj. Thank you so much, Dr. Bharat, Dr. Zeenat. Okay, so I hope you understand. So until my assistant doctors don't want me to take a Zoom on rubrics, I'm very happy, because otherwise it becomes 24/7 homeopathy. So let us go forward. We have few seconds left. Any other question? Thank you so much, yeah, Dr. Navjot. And you can call me today evening, Dr. Navjot, because tomorrow I'm going to Bombay and one of the case you have already cured. Okay, very nice. And rest I will talk to you on the phone. You can call me after 5:30 because I'll just finish my live and then be on the line. Tomorrow I'm at Bombay, so I'll not be able to answer you tomorrow. Any more questions? Some questions have scrolled up, so you can always keep ready so that next time when I come on YouTube, we can start this question. So it's already half an hour up, and thank you for joining, and thank you. I hope you understood what I want to tell you, and I hope you enjoyed it as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Thank you.